Namaste. In this video, we shall discuss the oral consumption of self-urine. Actually, this is the first internal application one can use of a urine therapy. Actually, self-urine is one's own perfect medicine. Self-urine contains the mirror image of our internal system and hence, when ingested orally, gives positive feedback to our immune system. Therefore, urine can be consumed by any person of any age for better health and healing. So, what could be the sample? Ideally, the first sample of urine in the early morning is considered to be the most potent and effective. The first sample of urine after prolonged rest contains important hormones, enzymes, electrolytes, and immune stimulators. It is generally said that morning first urine contains melatonin, and this particular melatonin improves our vitality and maintains our enthusiasm throughout the day. What could be the dosage? Optimally, 200 ml of urine is found to be effective. However, one can collect and consume the whole of urine that is available at that given time. For children of age 1 to 5 years, the dosage recommended is 1 to 5 ml. And after the age of 5 years, up to the elderly age, one can consume more than 200 ml of urine at a given time. Generally, for me, my father has taught me when I was a 1 or 2 year child, and since then I am drinking my morning first urine. Whatever it comes, I keep drinking, and since last 50 years I am drinking, and I am 54 years of age. What is the procedure? People do ask. Traditionally, it is advocated that collect the midstream urine in a sitting position while facing towards the direction of rising sun in the morning, that is the east direction. Here, the midstream urine means leaving out the first 2-3 spoons and the last 2-3 spoons of urine, and collecting the entire midstream sample is advised. The urine has to be collected in clean vessel, and vessel could be of a glass or a earthen pot, or that pot could be of a steel, iron, silver, gold. Even a copper vessel is suggested as a vessel. So before drinking, while holding the vessel in the hand, in Tantra Yoga, that is the traditional scripture where the urine use is mentioned, it recommends to chant a mantra and drink the urine as a medicine. The brief meaning of that mantra is, "O nature, I am drinking my own divine medicine, and please help me and make it so." That is the meaning of that. After drinking urine, one can drink little water if needed. However, one should not drink or eat any food items until 1.5 hours after urine consumption. This technique of drinking urine in the early morning is called as Amroli Kriya in yoga. So what are the indications? Actually, anyone with any age or gender can drink the self urine once or twice a day for maintenance and promotion of better health. What are the contraindications? Person with renal dysfunction must not consume urine orally. Actually, female during menstrual bleeding can avoid drinking urine. Person who are taking chemotherapy, those who are suffering from a cancer, or taking any antibiotics or higher potency steroidal drugs must avoid self urine drinking during the phase of the time. Here one point you have to note, that person with a diabetes, hypertension, arthritis, or any heart disease can consume self urine along with their routine medicines. However, they must keep a gap of 5 to 6 hours between the ingestion of the medicine and urine drinking. When you start drinking urine, what is the immediate effect you see in your body? That is, often when first sample of fresh urine is ingested orally in the morning, as it is being a hypertonic solution rich with electrolytes and nitrogenous compound, it shows gentle laxative, and detoxifying effect. The ingested urine slowly softens the intestinal contents and then enhances the peristaltic movement, leading to clean and clear bowel motions. The effect is directly proportional to the concentration of the urine. It is common observation that after drinking urine, one feels fresh, energetic, and poised. The joy of evacuating bowel motions is known only for urine drinkers. People who find difficulty in drinking urine can begin with urine gargling. Then, gradually, the reluctance towards urine therapy will disappear. Actually, urine gargling helps in throat infection, toothache, and other oral as well as throat related problems. In this, urine should be kept in the mouth for 5 to 10 minutes. Fresh urine is to be used for rinsing and gargling the oral cavity. So, start drinking from today itself and stay healthy. Thank you.